go through our three principles with remarks and then host Q&A at the end. Thank you.
Good afternoon. My name is Andrew Phelps. I'm the director of the Oregon Office of Emergency Management. Joining me today is Director Rachel Banks of the Oregon Health Authority Public Health Division and Director Fairboris Paxaresh of the Oregon Department of Human Services. As everyone here knows, last month we experienced an incredible excessive heat event, something historic for our state and something that cost the lives of at least 83 Oregonians. Governor Brown, following that event, directed our agency as the state's lead agency for preparing for, responding to, and recovering from emergencies, disasters, and other events to facilitate an after-action review of what worked, where we need to improve, and to make a series of recommendations for next time. With triple-digit temperatures expected in the forecast this week, that next time has come very soon. Many of the recommendations have already been implemented. We need to make sure that the long-term recommendations are also considered. But as we address the heat event that's forecast for much of our state this week, you will be seeing changes in how the state supports our local and county partners during their heat events. It's important to note that there was a sense of urgency with this after-action review. We've typically facilitated after-action reviews in the past. Many of those reviews take months to meet with stakeholders, collect data, analyze that data, and make formal recommendations. Knowing that we're still at the halfway point of summer, we have a lot of summer ahead of us and a lot of opportunities for extreme heat events. The fact that we're able to release this report today in advance of this next round of extreme heat is important to me, and I know it's important to all Oregonians. We understand that at least 83 Oregonians at this point have been verified to have lost their lives due to the extreme heat event. This is an unacceptable tragedy. We understand that many of the folks who did lose their lives lost their lives alone, at home, and without air conditioners. Many of these deaths, in my mind, were preventable. It's devastating to learn that people were unable to access help despite extensive outreach and efforts to provide help and make resources available to Oregonians who could be impacted by the heat. But we need to ensure that any barriers that were experienced in folks getting to cooling centers or seeking medical attention, that those barriers were eliminated. That was one of the focuses of this after-action review. As we head into this weekend, we are anticipating triple-digit temperatures across much of the state, and this has the potential to put our most vulnerable Oregonians at risk. We also need to remember that the weather events we continue to see, these climate-driven events, these are not anomalies, but indicators of the types of emergencies and disasters we can continue to face, whether it's wildfire, whether it's flooding, severe winter storms, and certainly fluctuations in temperature. We also need to make sure that we are not preparing for we are not preparing for yesterday's events, but we are preparing for tomorrow's events. Our climate is changing, and we need to make sure we're adapting to this changing climate. As we continue to recommend changes to the state's posture for emergency response and certainly to response to heat events, we also need to make sure that Oregonians are doing all they can to prepare for whatever may lie ahead. Developing emergency plans with your family and your communities, ensuring that you have a supply of food, water, medication, copies of important documents, and registering for the new ORAlert system to get notifications during events is a really important part of every Oregonian's emergency plan. I want to highlight real quickly the four primary recommendations that we are recommending. There are 16 recommendations total in this report, but these are the four that have emerged as the most urgent and for immediate recommendation. We need to ensure we have increased health information sharing from our health partners, especially our healthcare providers in our community. Heading into that June event, there was a lot of messaging about the potential impacts of extreme heat and record-setting temperatures. Having access and being able to share the actual impacts in almost real time, being able to allow that data to drive decision makers will allow us to change our posture, provide additional resources if necessary, make sure that our local city and county partners have that information, and amplify our messaging, increase the urgency and, quite frankly, the gravity of the messaging that we're able to share. These are not the potential impacts of a heat event. These are the real impacts of the heat event and how they're impacting Oregonians. We also worked during the heat event to ensure that the 211 call center was accessible 24 hours a day, 7 days a week. We need to ensure that moving forward. There was a delay or a gap in 24/7 211 coverage. That was rectified during the weekend, and moving forward during events like that heat event, we need to make sure that 211 service is provided around the clock. We're also continuing to have dialogue with transit partners. Again, transportation should not be a barrier for folks accessing the help they need during an emergency. Waiving fares to ride public transit, exploring voucher programs with taxi and rideshare companies, all factor into the accessibility of transportation. Transportation, again, should not be a barrier for folks to be able to seek the help they need to protect themselves and potentially save their lives. We also want to continue to reference the importance of neighbors checking on neighbors. We know that lives were saved because folks checked on their family members, people in their community, and coworkers. We also know that folks checked on their community members or neighbors, or family and coworkers, perhaps in the morning, and by that afternoon, folks were having serious complications due to the heat, and for many Oregonians, it was too late. Checking on neighbors means more than maybe just a phone call. It means actively knocking on a door, driving across town to check on someone. And if you can't do that, calling your local emergency services for a public safety welfare check. These are all things that can save lives during an event like what we experienced back in June. It's important to note, part of the messaging needs to include the very plain message: heat can kill, and heat has killed in Oregon. We all need to be mindful of those risks and do our part to take care of ourselves and our communities. Finally, I want to highlight some of the long-term recommendations in this report. These climate-driven events, it's more than just that immediate response. We need to look at how we're reducing our risk of future fluctuations in temperature, extreme high temperatures, low temperatures, et cetera. Incorporating recommendations and developing projects to reduce the impact of heat through our state hazard mitigation plans, and working with our local partners and tribal partners to develop projects for federal funding through hazard mitigation plans and planning grants, as well as project grants, can go a long way towards long-term reduction of the impacts of heat events. Finally, I just want to close with a message about preparedness. We talk a lot here in Oregon about the need to be 2 weeks ready. Oftentimes that message is associated with a Cascadia subduction zone earthquake, but that really is an all hazard message. It's more than just earthquakes or tsunamis that can impact us. It's wildfires, it's floods, winter storms, and certainly extreme heat events. Doing a little bit now to help prepare for that first 2 hours, what do you need for the first 2 days during an emergency, and certainly for 2 weeks. Those steps can make a big difference in ensuring that we're all prepared for whatever emergency may lie ahead, whether it's a heat event or some other bad day driven by our changing climate. So as we look to the future, preparing for tomorrow's events, not yesterday's, and ensuring we're adaptable, leaning forward and supporting our community partners, our cities and our counties as they respond becomes incredibly important to us. I also want to note there are several after action review efforts being taken at the local level. I want to applaud and commend our cities and counties for developing their own after action reviews. We look forward to reviewing their recommendations and assisting them with implementing whatever recommendation they have for which the state can play a role. With that, I'll turn it over to Director Rachel Banks from the Oregon Health Authority.
Thank you, Director Phelps, and good afternoon. For the record, I'm Rachel Banks, the Public Health Director of the Oregon Health Authority. The new heat wave coming over the next several days, while not predicted to reach the same temperatures we saw in late June and early July, is really proof that we need to remain diligent in preparing Oregonians for what has become the new normal in our state. Extreme, record-breaking heat that creates deadly conditions for the most vulnerable people in our state. As Oregon Health Authority Director Patrick Allen mentioned recently, Oregon has recorded its hottest years in state history in the past 5 years, with climate models predicting more frequent and severe heat waves in our state. We are now seeing that play out with temperatures that would have been unthinkable, unimaginable, like 116 degrees in the Portland metro area only a few years ago would have been unthinkable. The extreme heat that we saw in late June and early July tragically took more than 80 lives in Oregon and prompted more than 800 heat-related illness visits at the state's emergency departments. It taught us a lot about who is most severely impacted by these conditions, but there is much that we already knew. People of color, many of whom live and work in communities located in some of the hottest parts of our state, are hit hard during times of extreme heat. During the last heat wave, at least 10% of the confirmed deaths were people of color. People with chronic medical conditions, such as heart disease, high blood pressure, diabetes, and cancer or kidney disease, are in particular danger during extremely high temperatures because they may be less likely to sense and respond to changes in temperature, and they may be taking medications that can worsen the impact of the extreme heat. As mentioned, access to real-time data is critical if we are going to respond quickly to communities where there may be shortages in resources or barriers accessing those resources when they are available. Oregon Health Authority, through its Essence syndromic surveillance system, can monitor reporting in hospital emergency departments for heat-related emergency department and urgent care visits. And we also monitor EMS activity as a way of tracking heat-related admissions. Timely information, we know, is and sharing of that information is key to helping people take steps to protect themselves and their neighbors and pointing them to places where they can get help. That includes posting regular updates to OHA's website, distributing information through the media and social media on how people can prevent heat-related illnesses, and supporting 24/7 availability of services like 211 during heat-related events with messaging that its operators can use to help people stay safe, healthy, and direct them to resources in multiple different languages. But we need to do more. We know that we need to know where our most isolated and vulnerable neighbors are, how we can get services and support closer to them, and how we can build up community around them to support in times of crisis such as extreme heat. We do that through extreme heat planning, which what we're doing and talking about with partners, phenomenal partnerships such as with our CCOs, local public health authorities, community-based organizations, Office of Emergency Management, ODHS, Oregon Department of Human Services, and health systems, as well as Regional Health Equity Coalition, hospital work groups, and regional hospitals. Finally, you'll hear us say this before, and I will continue to say it again. No one should suffer heat exhaustion or heat stroke because they are alone or don't have air conditioning, can't get to a cooling center or air-conditioned public places because of distance or mobility issues, or because they work outside when temperatures reach deadly heights. And as your public health director, I just want to remind all of us what we can do. Stay in air-conditioned buildings, not relying as fans as our primary cooling device, limiting outdoor activity, especially midday when it's in the hottest part of the day, avoiding direct sunlight, wearing loose, lightweight, light-colored clothing. When getting hot, or even as a prevention, taking cool showers or baths to lower our body temperature. This is key. We're asking people to drink water more than usual, and don't wait to drink water until you're thirsty. If you're outside or doing sort of exercising, drinking 2 to 4 cups of water every hour, and avoiding alcohol, caffeine, and beverages with amounts of high sugar, which actually can be dehydrating. If you see signs of exhaustion in yourself or others, things as heavy sweating, weakness, nausea, vomiting, dizziness, we encourage you to move to a cooler location, lie down and loosen clothing, apply cool wet cloths, sip water. If this is for your neighbors, your colleagues, your friends, or for yourself, call someone if you start to experience these symptoms. We are concerned about very severe heat stroke with a very high body temperature, hot, red, dry skin, and clearly if someone loses consciousness. If that's the case, please call 911 immediately. This is a medical emergency that it can be life-threatening. Clearly, we want to make sure that folks are moved to a cooler environment and applying wet cloths. And as we've said, please, Oregonians, check on your neighbors, your loved ones, your colleagues, and get them help if they're displaying the warning signs of heat stroke and heat exhaustion. And for all of us, even those who want to be independent, please monitor your own symptoms. And if you're starting to feel even a little bit of any of those symptoms, please call a family, a neighbor, someone, a buddy, and have that buddy system so that we can be checking in on each other. Thank you. And with that, I will turn it over to Director Paksharat.
Thank you, Director Banks, and good afternoon, everyone. Fairborn Paksharat, Director of Oregon Department of Human Services. We've been pleased to work with our partners in Oregon Emergency Management and Oregon Health Authority on this after action report to build on the lessons that we've all learned during this last month's heat wave so that we all can be better prepared for future events. In Oregon Department of Human Services, we have a specific and assigned roles during an emergency and crisis. In addition to our regular responsibilities to the population that we serve, we also have the responsibility for supporting Oregonians by providing food, water, and shelter under the state's emergency management plan in our mass care role and responsibilities. In that role, we work closely with 211 Info. They're a key partner, not just for us, but for some other public organizations. They make sure that Oregonians have access to information during emergencies, and as they recover from emergencies, they also can get that recovery information through 211. For example, you can call 211 to find where cooling center is during the heat wave, or finding a case manager for those who lost their homes in a wildfire. Since the heat wave, we work closely with 211 to ensure that they are available statewide 24/7, both online and on the phone, to connect Oregonians with the key resources that are available. 211 also received more funding during the 2021 legislative session, and we will work closely with them in the coming months to make sure that we continue to improve services. We also have begun working with our partner, Oregon Health Authority, on a shelter-in-place strategy to help Oregonians that we serve in Oregon Department of Human Services who are unable to leave their home during an emergency due to a medical or other limitations, such as significant transportation issues. For that population, often their needs are better served at home. For the heat wave that we are all expecting, we have coordinated to ensure Oregon Food Bank and other partners have adequate supply of water, and we can be responsive to our counties if they ask for assistance. Finally, I just want to reiterate what Director Phelps and Director Banks have already stated. We are working with partners to encourage Oregonians to check on their neighbors, friends, and coworkers who are especially vulnerable during an emergency like a heat wave. We all have responsibility, personal responsibility for our own safety, but also at times we need the help to know what we should do. Neighbors, friends, and family can also assume roles and responsibilities to support one another. We must all work together to get the word out to Oregonians about the importance of helping one another, especially during these challenging times. All of us need help, even the state. The wisdom is in the community, and we need the community's help to get through these crises. Let me stop there and turn it over to Bobby Doan from Oregon Emergency Management to start Q&A.
Thank you. Okay, so we are ready to start Q&A. We've got them in the chat, or if you'd like to raise your hand. Looks like Mike Benner, you're the first one up.
Yeah, thank you. This question is for Andrew Phelps, and maybe some clarity. You mentioned, Andrew, that you guys are engaged in dialogue with public transportation, and mentioned some exploration of, vouchers for rideshare. I mean, we're just hours away from this heat wave. Have any deals been struck? I mean, will fares be waived, on TriMet, and are vouchers available for rideshare?
Thanks for the question, Mike. Those are the recommendations that we've made. We don't have authority to direct jurisdictions to waive their mass transit fares. The recommendation is simply, if a community is opening up cooling centers, transportation to access those cooling centers should be free. During the last heat wave, I know TriMet indicated that if you were traveling to a cooling center, that you didn't need to pay a fare. We need to make sure that all transportation that the public typically relies on is accessible. I don't know if Multnomah County at this point has had a chance to review the recommendations we've made. Again, I know Multnomah County, City of Portland, and others are working on their own set of recommendations. But anything that we can do to alleviate or eliminate barriers to getting folks to whatever help they need, whether it's to an emergency department or to a cooling center, is important. And I also want to note too, mass transit, public transportation can serve as mobile cooling centers in a lot of ways. There is hesitation and resistance for folks to seek help from time to time. Anything that we can do to make it easier for folks who maybe don't want to go and sit at a library or a cooling center, but are perfectly happy to ride a bus for a bit of time to cool off, that those options become available, and paying a fare is not a barrier there.
Thank you. Right. I think we're ready for your question.
Thank you. My question is for Andrew as well. On some of these things like communication, urgency, making sure people have access to cooling shelters and transportation to get there, why did it take such a deadly heat wave for the state to realize those things?
Well, I hate to think that we haven't been doing a lot of this messaging and communicating the sense of urgency with a lot of the hazards that we've experienced. During the ice storm, we know how impactful those can be, whether it's the actual ice storm itself or the loss of power or folks utilizing generators inappropriately, leading to dangerous conditions within their home. As we work on messaging for something like an extreme heat event, again, we hadn't experienced an event like that before. So we were working off of potential impacts. Moving forward, as we go and make sure that we're tracking specific hospitalization information, a number of folks that are seeking medical treatment due to heat-related illness, that allows us to up the sense of urgency and not talk about hypothetical impacts and talk about the real impacts. These are things that are actually impacting communities. Folks are filling emergency departments because of heat-related illness. We've got a lot of history with other types of hazards in our state, flooding, fires, winter storms, where we can draw on some of that shared memory. And we as Oregonians say, yeah, you know what? I remember what that impact was like when smoke was blanketing my community and my child with asthma couldn't breathe. We haven't had those same experiences with heat up until June. Now we have that experience, and my hope is that all Oregonians take excessive heat watches and warnings and some other warnings from the National Weather Service about heat a little bit more seriously, since we understand just how deadly these events can be, especially in some of our urban centers.
Thank you.
Am I up next?
Yes, Amelia, go ahead.
Yeah. I want to better understand the 211 situation. So it would be helpful to just get a refresher on, is 211 a state agency or a sort of nonprofit, or what exactly is that entity? And then second, can you clarify the timeline for when on Saturday was 211 not available? For what period of time was it not available? And when did 211 become available again to people who had been told to use it to get information about cooling centers? So what was the duration of that? And then I guess just finally, has 211 never been staffed on the weekends, and will it be now? Will it be for this upcoming heat wave? There's no reason to think that natural disasters don't happen on weekends.
Bobby, I'll take that. Thank you, Amelia. 211 is a nonprofit, so it is not a state agency. It is funded by the legislature. So it provides information on behalf of state agencies to communities, and they operate in all of our 36 counties. And what happened on Saturday, again, we were not aware that 211 was not staffed over that weekend. So one of our emergency management staff called 211 because we had received information that people were calling 211 and were not getting responses. So we tried to call 211, the coordinator, and they got back to us on Sunday morning. The call was made on Saturday. And by Sunday afternoon, I believe it was 2 o'clock, they had staff that they brought on to staff the center. And as we all understand, especially if you're not operating over the weekend, it takes some time to call people, to line them up, to bring them back to work, etc. So we thought they were responsive considering the circumstances. Your question around is 211 staffed for this upcoming heat wave? Yes, we actually have agreement and funding for 211 to be staffed 24/7 at least during the summer, during the hot months. And we also have an agreement and contract with them for the wildfires as long as that is needed. So those things will be in place and they will be available 24/7 for the duration of the wildfires and as we transition to cooler weather.
Hey, this is Andrew. I want to go ahead and jump on the question that was posed by Ms. Flackus from the AP in the chat. Her question was, have we been able to determine how many of the individuals who died had been contacted by local authorities about the heat and made aware of rides and cooling centers? In other words, how many of the dead were contacted before or during the event? And I realize my camera is not on. Gillian, I don't have that answer. I'll look to Director Banks to see if she has any insights into data around that particular question.
Yeah, thank you for that question. I'm not able to answer how many of the folks who unfortunately passed were contacted. What I can say is that's why we really want to be getting the message out now. We're thankful for you all and the messaging that you're putting out, as well as on our website, as well as through community-based organizations in advance of the heat that we're going to be experiencing here in the next few days. We want folks to be getting messages from multiple different places, media, social media, their friends, families, and neighbors. And it'll take all of us to get the word out there so that people know that they have access to that information. So ideally, folks are being contacted by family, by friends. They're watching information on the news. They're hearing it on the radio. They're hearing it in languages that they speak, and all of those things, which is why we have those multiple different channels to be getting information out.
Thank you, Rachel. Jack, we'll go to you next.
Hi, yeah. So my question is actually another follow-up on the 211 nonprofit during the last heat wave. One of the major issues that people reported was that there was actually no prompt for the heat wave and for cooling centers. And on a cursory try of the number just today, that wasn't fixed. And a lot of people either gave up and never received the help that they were looking for when they called the number. And I'm wondering if that is going to be fixed for this heat wave and what's being done about that in the future.
Thanks, Jack, for that question. My understanding is that they will be ready to answer calls. I don't know about the prompt. We can find that out. It may just be the 211 general line that they would call. But just prior to this meeting, I verified that we do have 24/7 coverage from 211. In fact, we've had it since the last heat wave. So we'll definitely follow up on that and make sure that the phone tree is operating appropriately.
Thank you.
Thank you. And then Jen D.
Yeah, Jen from Coin 6. I was just wondering, maybe this is for Rachel Banks. With the heat wave coming and so many ER visits, I thought she said 800 the last heat wave, but yeah, correct me if I'm wrong. But and then we have COVID cases increasing. What does that look like, from an emergency room perspective this weekend? Is it, more important to stave off an emergency room visit this time?
Yeah, thank you for that, Jen. An important question. We're definitely watching hospital capacity closely, as we have for for some time, in conversations with hospitals. As you mentioned, we still have COVID cases, hospitalizations that we're watching. Right now, hospitals are in communications about capacity and understanding and making decisions about things that they can do to decrease capacity, or in other words, make sure that there is capacity for heat. We definitely want to see prevention being that there's a dual message here. One is, if you need help from the emergency room and you're sick, please get it. The other is, we want to do everything possible to avoid folks needing to be seen in the emergency room, taking those precautions, getting into cooler spaces, obviously drinking more fluids, and all of those things, so that we can maintain hospital capacity throughout the state.
Okay, I don't see any other hands raised. Do we have any other additional questions? We got Ben. Anyone else?
This is Amelia.
Can you hear
Is-
me?
Oh, sorry.
There you are. Go ahead.
Hi, this is not Ben. I don't know why I have Ben Fitz on here, but this is Sarah Hurwitz with Channel 12. Thank you for holding this. I was curious, and I'm not sure if this is a DHS question, but when we're talking about doing checks on folks, particularly, you know, people who might be in like the high-rise buildings, things like that, how often is that happening? You know, it sounds like the message here is also to really rely on the community, but for folks who are designated to also help in that regard, how often are they doing that? What is the, you know, system in place for that? Are there going to be more checks in that regard? That kind of thing.
I can take that, at least for the population that we serve, and naturally, you know, people who are in long-term care facilities, people who are in skilled nursing homes, etc. We do communicate with the providers around condition, etc. Many of our case managers and aging and people with disabilities during these times do check with their consumers in developmental disabilities. But again, please keep in mind that's a very small population compared to the general state population. So I am not aware of any systemic reaching and checking on people statewide. At least we in ODHS, again, that's the extent of our activities, and even within that, it's difficult to reach everyone just because of the nature of how many people we serve.
Fair Boris, let me add to that real quick for Sarah, who is not Ben. That underscores, I think, really one of the differences between a heat-related event and some of the other events that we've experienced. And thinking back to the February ice storms, it was a little bit easier to isolate who needed those levels of checks. With the folks that lived in isolated communities, maybe they couldn't travel down their road because trees were down, and we knew that those homes didn't have power. That makes it a little bit easier to prioritize the finite resources we have in the state to do those welfare checks. When you talk about a heat event that's impacting hundreds of thousands, if not millions of folks in the state of Oregon, trying to mobilize a force to knock on every door that may be impacted is an impossible ask. There aren't communities that have the resources to do that, which is why we're needing to be a little bit more creative here and relying on the public to help understand who is vulnerable in your community, who's vulnerable in your circle, and what you can do to try to reach out to those folks or get them the help that they're going to need. There are things we can do that are a little bit more creative that aren't part of that formal response system. It's not the National Guard going and knocking on doors, but it's medical providers reaching out to their patients. I receive a notice 24 hours before I have a doctor's visit, reminding me I have a doctor's visit. Can our medical providers reach out to their patients and the folks that see them for medical care and check in with them and remind them that there are things that they can do, especially if they're at risk, to help take care of themselves? Utility providers reaching out to the folks that rely on them for service. I'd much rather folks hear these messages about preparedness and the dangers of heat events a dozen times than not hear about them at all. So it's not just relying on one level of government or one agency or one discipline. It's this whole community approach, neighbors helping neighbors, and trying to leverage the different touch points we have in our communities to reach the most vulnerable.
Okay, we've got a couple additional questions in the chat. So a follow-up question from Jen at Coin. They had heard 83 deaths today in the report, but previously it was over 100. What is the number, and can you explain the differential there? And Rachel, do you want to take this one? Thank you.
Happy to. Yeah, so we have 83 confirmed heat-related deaths, and part of the process when we have those death investigations is a comprehensive process that ultimately leads to providing information for a death certificate and so on and so forth. We clearly take that responsibility really seriously on behalf of those who have passed and their families. There are additional investigations ongoing where we're looking at toxicology screenings and a variety of other things to ultimately make a determination by the medical examiner of the cause of death. So at this time, 83 are complete. There are additional ones that get to that 100 number that you mentioned that are in process. And I would just add in that those may or may not end up being classified as heat-related deaths.
Rachel, there's another question in the chat. How many additional cases are in question? Do we have that number?
Last I checked, it was 116. And someone correct me if I got that wrong.
Looks like Amelia has validated and verified that response. Director Banks, thank you. I do want to address Ms. Templeton's question in the chat. What's your one sentence explanation as to why so many people died when we had multiple days advance of this event? Oof, a one sentence explanation. I think if I were to put one sentence together that would maybe explain it, it was a lack of understanding of how quickly extreme temperatures like we faced in June can impact someone, especially someone who's at risk. A couple of follow-on sentences to that, Amelia, if I may. Director Banks might be able to speak to the actual impacts of heat illness more than I can, but we know that as heat begins to impact folks, it alters your mental status a little bit. You maybe aren't thinking as clearly, and that can delay a decision to seek medical treatment. And we also know that folks can be resistant to taking the steps that are needed to alleviate extreme heat. There are folks who feel safest at home. Those folks may not feel comfortable or feel the need to go and seek a cooling center. And then by the time the heat is impacting them, it may be too late. This was an unprecedented event, and we've been saying that a lot. And it's important to note that as these events become more frequent, they're no longer unprecedented, they are to be expected. So my hope is, in addition to the recommendations that we've made and the changes we've made at the state level, and the changes I think we'll probably see at the local level, every Oregonian now understands the severity of extreme heat, the way we understand the severity of wildfires and floods, and some of the other hazards that we experience much more frequently. And Director Banks, if you want to talk just a little bit about maybe the heat impacts and how that can impact someone's ability to seek help.
Yeah, thank you, Director Phelps. I think you really queued that up well, is that some of the impacts could be confusion, dizziness, or clearly loss of consciousness, which would make it harder or impossible for someone to seek care. I would just underscore this is, really unprecedented, and there are a variety of reasons why, we're understanding folks may or may have not been able to or wanted to seek care. And so this is really about identifying where those systemic issues, whether that's transportation, decreasing the barriers, whether it's communication, getting resources closer to where people are, all of those sorts of things, as well as for us thinking about the long-term impacts of tree canopy and ways that we can and mitigate climate change and increase health for people.
Okay, we have time for just a few more questions. Jack, I see your question, a follow-up from your previous. If there aren't specific prompts for cooling information or rides, how can the state know that people will get the services they need? What's the state's guidance? Is it to press 0 and talk to an operator? And how long are people going to need to wait on hold to talk to someone live? So I think this is speaking to 211. So Fair Boards, if you'd like to take the initial there, and then I think Andrew can follow up with anything that, just in case, Jack, if you have any clarifications there.
Thanks, Bobby. Yeah, I don't have the answer to that question right now. We definitely can find out whether there is a particular prompt for this coming weekend, or can the general 211 line answer that question. Again, I really appreciate you if folks are contacting you and bringing it to your attention that they're calling 211 and their issues. We really appreciate knowing that, and that's what helped us last time to actually become aware of this and address it. And 211 is working very hard to put a structure in place to be able to address all the calls. I don't know about the wait time, but we can find out. And again, just by you bringing this to our attention, we'll work with 211 to make sure that everything is as planned as we enter this this next heat wave.
Thank you. And I can follow up with your office just to see about that prompt. But thank you so much. I appreciate it.
Thanks, Jack.
Okay. Safara has a question there, Rachel. Just to clarify, there are 33 deaths believed to be heat related that are still being investigated, or have any of those been ruled out?
That's correct. 33 that we're still investigating.
Okay, barring any other questions, and we are running out of time. If you have any additional, please feel free to email and we will make sure to get back with everyone afterwards. But in the meantime, I'm going to go ahead and turn it over to Director Phelps to close us out.
Thanks, everybody. Thanks, Bobby. Really appreciate my partners from Oregon Health Authority and from the Department of Human Services for being with us this afternoon. Bobby, you want to?
Oh, I'm sorry.
Thank you. So I do see one last question there from Wright. Targeted communication effort the next few days. We've already seen quite a bit of targeted communication from the National Weather Service, local jurisdictions, as well as state agencies, calling out some of those cooling center options that are being established. But again, I think what we want to make sure that we're conveying as part of our additional outreach is the severity of the situation. We now have this event as that comparator to say it's not just hypothetical, what a forecast might imply. We now know what extreme heat can do in Oregon and to Oregonians. So that will certainly be reflected in the message going forward whenever we have these excessive heat watches and warnings. I just want to close real quick with a reminder. There are things every Oregonian can do to be prepared for extreme weather events. These are happening much more frequently in our state than they have previously. And we're seeing things occur like fires and floods and winter storms in parts of the state that normally wouldn't experience those types of events. We want to remind Oregonians to register for notifications through their county notification system under the ORAlert program. This is a great way to stay in touch with your community during emergencies and get that timely and accurate information. And I also want to thank our media partners. Part of the after action review that we did was to assess the type of communication that was out there, not necessarily from government channels, but coming from our media partners. And we documented over 80 news stories related to the heat. The partnership, and I believe it's a partnership that we have with our media to get information out, to let folks know what response looks like and things that Oregonians can do to protect themselves during extreme events, plays a huge role in the work that we do. The impacts of the June heat event, I think, stick with all of us. And they certainly drove this need for an expedited report because we just can't look at events like extreme heat as something that's a number on a thermometer. These have real impacts to Oregonians. We've seen those impacts. And what you've seen is a mobilization of resources, of outside the box thinking, to figure out what we need to do better as communities, to message some of these threats, to ensure folks have access to resources that are available in their communities to protect themselves, and look at long-term strategies to reduce the impacts of our changing climate. When we do these things in concert, we do them collaboratively with our local partners, with our state partners, with our nonprofit organizations and private sector, those will go a long way towards more positive outcomes when we have future events like what we experienced this past June. Thanks, everybody. And again, as Bobby Doan said, if you've got further follow-up questions, please send those out to us and we'll do our best to answer your questions and follow up. Thank you.